Now I'll hand over the platform to Dr. Raghavendra Prasad, and rest is history. Thank you, sir. Welcome.
Thank you, Dr. Khalil, and dear friends. Today I would like to tell you about the so-called internship, or rotating housemanship is another name, or medical intern is another name. I have been watching for decades. I am sure Dr. Khalil also has gone through his internship. Days were totally different. We were taught, we learned many things. But as the years went on, internship has become casual, routine, not focused. They are not able to really know why they did those internships. Today, I'll be talking about what is internship and how it should be done. I may not really talk about where it should be done, because that has become an issue of late. People want to shift a different hospital. People want to shift to another this thing for maybe some reasons unacademic, maybe the reasons based on personal reasons, but that will not help you. The best place to do is a place where you studied. One, because your teachers know you and your strengths and weaknesses, and you can really learn much more than going and doing internship in an aligned place. I'll stop at that as far as where to do. Today I will concentrate on what is internship and how to go about it. This was called rotating internship because you rotate amongst various specialties. This rotation scheme also has changed of late. Previously, we used to all have broad specialties 1 month and the subspecialties only for a short time. SPM was a very, very short duration for us. But now you have maximal amount left kept for preventive medicine. But it's all right. Whatever it is, how to go about, even in preventive medicine, what are you doing? You are wasting your time. Therefore, I would like to stress from now onwards, what I am going to see, then how you are to do internship. I am going to concentrate on these factors. That internship, I would stress again, is an important stage of career. You become a doctor, and the first step of becoming doctor, if you want to climb up the ladder of medical life or medical career, the first step is internship. And it is a real time to learn really. Real learning time is internship. I will elaborate each.
Excuse me, sir. 1 minute. Sir, do you have a PowerPoint presentation? Or
yes,
PowerPoint. Because that's not visible. I think you have to share that.
Is it visible or not visible?
The PPT is not visible, sir. Am I right, Hania?
No, here it says my PPT.
It's visible.
It's visible? Okay, that's great.
Yes, sir, it is
Carry
visible.
on, sir.
Is it
Carry on,
visible
sir.
or not?
Sorry.
It's visible, sir.
It's visible. It's visible, sir. Carry on.
For all of you?
Okay.
All of you?
Yes.
Can I go ahead?
Sir,
Yes, sir.
Yes, okay. And under these heads, I'm going to talk about internship. An internship is a period where you initiate yourself for skills. This is practical practicing time. Therefore, you learn the tips and tricks of practicing medicine. The very first day of internship, you are introduced. Then time to prepare for future. I'm going to talk about how do you prepare for your future. Then time to establish the foundation. Building the castles in the air. I'll go to postgraduate institute in Chandigarh or All India Institute. I'll go to USA and do something. Very good. But if the foundation is weak, they remain castles in the air. No meaning in building castles in the air. And this is a period that you can never be wasted. I will elaborate on that as I go on. And then remember that this period will never return. A period that is a foundation period, a period you start learning skills, a period you learn so many types of things at internship if you cannot get back the internship. And that part you have to remember. Then coming to each one of them, it's an important stage of career. Till yesterday, you were a student, but today you are called a doctor. Does it make any difference? Yes, it makes a lot of difference. Because as a student, you are guided. As a student, you chase the examination. And exams chased you. And as a student, you did not have a responsibility. As a student, you were answerable probably to your parents and partially to your teachers. But in turn, remember, it is no more examination. Now you need to change your skills. What skills I'll go about in a minute, in the next slide. You need to develop that attitude and aptitude. Attitude is not show off that you are a doctor, elevate your white collar, go around telling everybody you are a doctor, and look for a groom who is also a doctor, or pay a lot of money to buy a doctor. That is not the attitude we want. Attitude of a doctor. Attitude of a doctor is threefold. One, doctor is one who cares for the patient. Doctor who is the one who feels the pain of the patient. Doctor is one who keeps updated to alleviate the pain of the patient, to answer the problem of the patient. In due course of time, you may earn money. That is not important. Then aptitude. You should be very, very decided and focused and develop that aptitude of growing like a doctor. Post graduation is another step, but that doctor continues to be there till the end of our life. Till last day, we may feel I might have become little better doctor than what I am today. And this is the time everything needs to be planned. I am going to plan a sketch for you, keeping the modern necessities of the current necessity of modern intern, and also keeping some minds which are negative things which I have observed during course of my last few years as a teacher. This is the real time to learn. What do you learn? You learn till yesterday from books. Although you have been guided to read some books, you read your own book of your choice, which was popular or which you liked because it is sharp and short. You never bothered about what you learned. You were bothered about how many marks you get. But today, it is not like that. Whatever you have learned from any book in last 4.5 to 5 years, you need to practice. You need to apply your knowledge in day-to-day management of the patient. Every aspect of the patient. Once you receive them, the way you examine is totally different as an intern as you examine as a student. Then what you document and participate in counseling, learn how counseling is done for admission, after admission, before a procedure like surgery, after a procedure, death or discharge. At every phase you learn these skills. And what are the skills you learn? Important to know. Documentation skills. I am stuck with that there is no single intern I have seen for more than a decade and a half who is interested in writing the case sheet. The first document you learn is clerking, and that has got neat questions in that first 2 pages of case sheet. Nutritional assessment is there. Basic CNS examination is there. Basic growth and development parameters are there. They are your neat questions. Still, you do not write the first 2 pages. Remember, documentation starts from there. You learn how to document. Clerking, it was the word used by Britishers, was clerking. And this documentation teaches you today the first 4 printed pages properly filled by item, you will learn. And some of the questions will come in the need, in the nutrition, in the pediatrics, in the SPM section. Remember then, diagnostic skills. You learn diagnostic skills, and these diagnostic skills, you had only DD and getting a lump, whether it is a lipoma or something else, during your studentship. Here, a comprehensive diagnosis. Comprehensive diagnosis from the viewpoint of therapy, relief of pain, relief of disease, cure of disease, or a palliation. These are the aims. For this, your diagnosis should be accurate. And for that, you will climb up the first step of examining and doing the investigation necessary to arrive at nearest differential diagnosis and plan your treatment accordingly. These diagnostic skills will not come by absenting yourself as an intern. You have to come 1 hour before, leave 1 hour after everybody comes. And therefore, that 1 hour Go and read, examine patient yourself, document what you have seen, get it corrected during the rounds and after that. Then you will go on improving every day. Then you have got procedural skills. I am yet to see an intern who can start an IV line. They run away. Sister is starting, they look from behind. Catheterization, they don't do. They don't do abdominal paracentric tap. They don't know how to do liver biopsy. They don't know how to do intercostal drainage. They don't know how to change a tracheostomy tube. They don't know how to take a skin biopsy. They don't know how to do lumbar puncture. And these are all, if you take, there is a small booklet given to each of you to say what are the things that you learn in internship. But you come at the end for a signature, saying that you have done 10 vasectomies, 20 something you have done, that number you fill in. You don't want that false numbers. Do really and enter. These procedural skills are mandatory. In no other phase of life later, you learn how to start an IV line. I know many subspecialists and super specialists cannot start an IV line for their patient. They wait or hand over the patient to third party, maybe an anesthetist or a critical care person or somebody else. You should not reach that phase. Please start learning from day zero, that is today, from procedural skills. Then the next skill you need to learn as an intern is communication skill, which you have not been taught. Whatever communication you did for presentation of a case, that's all. As an intern, you need to learn communication skills required to be a doctor, a good doctor, good medical scientist, good postgraduate, good subspecialist, good super specialist, good medical administrator, good director, and so on and so on. Therefore, the communication skills, learning step, again, internship is the first step. First, you stand by your faculty member. He keeps on talking about the diagnosis, how he convinces the patient for admission, how he convinces for the procedure, how he explains the pros and cons of the procedure or the diagnostic scheme that is going on, how he convinces to choice of the patient to choose the type of option of the treatment available, how he convinces. This type of communication skills you need to learn every minute as you come a house surgeon. And this comes only by staying in the wards. It will not come by scooting the internship, simply coming for signature. You will not learn all this. Lastly, teamwork skills, very important. Medicine is a teamwork. I cannot work without my nurse. I cannot work without my laboratory experts, both biochemistry, pathology, microbiology, and others. I cannot work without my administrator. I cannot work without my juniors. I cannot work without my anesthetist. And therefore, remember, I cannot even work without my engineer. Any of my instrument goes what, he is going to come and repair. These teamwork skills are important. Remember, teamwork is a hardcore part of real life. We need to have a team of wife and husband and children, parents on either side, friends all around. That circles go on and on. Team is an essential core of existence of life, all the more in medical practice. These teamwork skills you need to learn. Is there a skill to learn teamwork? Yes. What is that called? Tolerance and accommodation. You need to become tolerant to others. Listen to them before you talk, before you answer, to accommodate them. Our 5 fingers are not the same. Why do we expect all our colleagues to think the same way? I give option and discuss it out, whichever best you can follow. Therefore, you need to learn these teamwork skills as an house surgeon. Second part is, this is the practical practicing time. Therefore, everything hands-on starts from internship. Till now, you would never touched anything. But today, you need to touch. You need to do enema yourself. You need to give an IV line yourself. You need to do paint a patient yourself. You need to do skin suturing yourself. You need to do LP yourself, hands-on. Everything hands-on, from documentation, communication, procedural skill, teamwork, everything hands-on has to be done. And remember, the examination with responsibility. As a student, you examine, but not with responsibility. Here, you examine with responsibility as a doctor. As a doctor, you have responsible to the patient's safety, to the patient's privacy, to the patient's comfort, and at the same time, to come to a conclusion of diagnostic or a therapeutic intervention. Then resuscitation. I am sorry to tell, many people, even after passing their post-graduation, are very poor at resuscitation. They simply said American College of Cardiologists procedure followed, that patient declared dead at so and so time. No, start learning hands-on resuscitation. Repeat whatever you have learned in triaging. Do a triaging at a tertiary hospital level, in the casualty, during transport, in CT room, in pre-op room, just before intubation, during procedure, in the post-operative, transfer of the patient, transfers to ICU, receiving from ICU. These things, every step of resuscitation has to be known to you, and you have to do hands-on. Then you will become an authority as a doctor. Everybody will say so and so is a good. You can tell him, we may not depend on. I had number of MBBS interns whom I have taught here in this hospital. They were far better than many postgraduates, and they published papers. They did all the work. They even did outer layer repair of hypospadias, which is a super specialist job. Then true documentation you have to learn. Unfortunately, you are not learning documentation. Writing a case sheet, writing clerk, writing informed consent, other consents in the case sheet, operation notes, discharge notes. This you are not learning. You are learning from years gone by. Write everything, IV fluid, saline, that you write. Don't write the real required in the discharge card. Remember, discharge card is the face of the hospital. If it doesn't contain anything, our face is defaced outside. So the patient goes to third hospital. Arey kya hospital hai yaar? Discharge mein kuch bhi nahi hai. Laparotomy done, no findings, no procedure done. What happened in the post? These are not written. Simply admission, IV fluids, antibiotic, omeprazole, something you write and sign and send. That you have to learn. The very fact you learn very first day, you ask what to write on discharge card. And that discharge is the face of the hospital. What we have done, what we want to do, how we want to follow up is depicted in the discharge card. This documentation you have to learn. Death certificate, another place, lot of laws. We do not follow international law of this death certification, primary, secondary, antecedent call. For everybody, cardiopulmonary arrest. That is not everybody. One of us have to die either pulmonary, or cardiac, or both. But doesn't mean that it is the real cause of death. Then you have to learn hands-on counseling. Counsel, after listening to them, counsel yourself next time for dressing. Then you counsel for IND. Then you counsel for sebaceous cyst excision. Then you counsel for LFP, LP, like that. Then remember that you need to have hands-on participation in all procedures and activities of day-to-day work in the hospital. Then it is time to prepare for future. A biggest thing in the name of future, you spoil today. If today is spoiled, tomorrow is automatically spoiled. If you don't learn skills as an intern, when will you learn? Time lost forever. You will never learn. Therefore, you need to prepare. What are the times to prepare? Professional, personal, and social aspects. These are the three aims of preparing for future as an intern. Professional, post-graduation or practice. Personal, marriage now or marriage later. Social, where to settle. We will try to look into the details. Professional, whatever profession you decide, be it as a practicing doctor or a super specialist, subspecialist, whatever your target are, the following things are a must. What are they? Discipline. Today you already broke the discipline by coming late. Late means you are lost in losing the time which never comes back. 11 o'clock was the meeting, none of you were there. Discipline is the one that makes us big. Think of any big leader in the world. Why are they big? They follow. Holiday, no holiday, 5 a.m. they get up means 5 a.m. they get up. They do everything daily and no holiday. For discipline, there is no holiday. Enjoying holiday is a part of discipline. Disciplined holiday is a discipline. You need to learn time, on time or in time, very, very important. If you want to start anything on time, you have to be in time, 5 minutes before. 2 o'clock means 2:15 is not discipline. And that is the disease from which we have to get rid of. It is in your hands. If you want to grow big, you have to be disciplined. Then responsibility. Take responsibility. If there is a mistake, tell, sir, I did dressing, I inadvertently pushed the drain out. Nobody is going to throttle you. Tell responsibility. Sir, I only wrote, sir, I thought it is septic shock, but I forgot that he is bleeding internally, hemorrhagic shock I missed. No problems. By taking responsibility, you are paving good future for you. That means whatever tell in future as a teacher, as a guide, or a senior is going to be taken very well. Then dedication. This is totally lacking. You people are not, we were all grown up. You cannot say somebody will tell you what to do. Somebody will say medicine, somebody will say surgery, somebody will say paramedical course. No, that is not the one. You need to dedicate yourself to whatever target you have. You need to dedicate all aspects of your life, from time, eating, sleeping, attire, dressing, and behaving, talking. Everything you need to do yourself to have a better future. And that part you have to now dedicate yourself to that target reaching. Target of our reaching is die as a good doctor, die as a good specialist is the final target. That means we need to be dedicated to what we want to do till death. There is no holiday. Then determination. This is lacking. First 6 months you want to leave vacant. Don't do anything. Come as a group and go. You don't even maintain your apron very well. And focus. Totally missing. You do not know what your target is. You need to focus on whatever target yourself have decided. Remember, internship is not a time to waste. All of you are wasting your internship in the name of private classes somewhere, in the name of needs somewhere 1 year down the lane, in the name of second attempt. Nobody tells me, assures me, nobody has given me assurance that they will get NEET rank in the first chance. Everybody says, no sir, pura previous batches ka, kabhi 2-3 baar ko 10 logon ko aaya. But why do you waste time now? On all weekends you don't do hard work. You go there again, pay 80,000, 90,000 and appear for morning till evening classes. Same classes were held for you for 4.5 years. Never bother to learn. But get back. Remember, internship should not be wasted. If you waste, you cannot get back. If you pay 10 crores, you may get a post-graduation seat. But nobody can give you back internship. There is no law in anywhere in the world to make you back an intern. You cannot. Nobody can make you. You can only call you junior resident, first year PG like that, but cannot be intern. Therefore, remember, do not waste internship. From today, gear up. Don't waste a single time minute. What is the professional plan? Professional plan in general is a good doctor. Therefore, a good doctor is a practicing doctor. Good doctor is a subspecialist, specialist. Good doctor is a medical administrator. Good doctor is at higher level, WHO level, health planner for entire world. But remember, you need to be a good doctor. Therefore, professional factor, good doctor requires back discipline, responsibility, dedication, determination, focus, and not wasting time. Then you need to be a good medical scientist. Observe. Even if you are a family practitioner, observe, document the observation, think of what is the cause of those observations. You become a scientist automatically. That means you are observing something, putting it to test. Once you put to the test, it becomes research, hypothesis. Then almost all good human beings. Unfortunately, only 10% of MBBS students finally will become good human beings. I do not know the reason behind that. That is my analysis for so many 45 years. Every year, some percentage of becoming bad for many reasons. Jealousy, professional jealousy, or what is that called? Greed to achieve something beyond the means and beyond normal way of acquiring things. Then remember, internship is not NEET. It is not just NEET. Internship is for life. Internship is for career. Therefore, NEET is only a step. Give some time to NEET, but not entire time to NEET. And lastly, start developing attitude towards research and publication now. First 6 months, start collaborate with the person who is interested to publish something, get his data, or Develop your own data in 3 months, analyze them and make it a good article and publication. First step of learning how to do research, how to do publish is again internship. Personal, again big area of conflict and confusion. Many students do not know what to do as a personal level. Although my talk cannot go into the intricacies of personal requirement as an intern, but generally I will tell you. Then remember, don't tell yourself, say parents want you to get married. Don't say I don't want. No, it is not true. If you speak to them, do not refuse anything personally. Personal things are, for example, marry or not to marry, if marry, when to marry, if marry, whom to marry, if married, what to do, where to settle, like that, these questions have to be answered. Do not refuse the reality. Ground reality is personal life and professional life are like the two lines of railway track. If any one line is bad, the gadi lutak jata hai. Therefore, you don't want to be a good human being, good doctor, as well as a good husband, good father, and good son and good brother. For that, both the lines, personal and professional rail line, should be intact. The tract of two lines should be parallel, should be on the same plane. Then the life called the gaudy life, the life of life, will run well smoothly. Next, accept reality. Ground realities are plenty. You may achieve, you may decide to do something. Yes, try to do. But ground reality, who you are, what you are, how much you are, you only will know. Therefore, accept reality and plan and plan. Very, very important. At every stage, plan. Execute, see the result, modify the plan. Again, execute, modify the plan. All the time given is you for 12 months to plan for entire life, both professional and personal. Marriage or no marriage, but plan with future in mind. Remember, you know already seen so many seniors, faculty members, etc. Clearly, when to marry, clear. The best time to marry is at the end of first year of post-graduation, if you want to do post-graduation. Or at the end of internship, last month of internship, get married, so that you can live happily. Or marry after third year of post-graduation. That is how you need to plan. That is how you need to plan, and this plan has to be very well coordinated. Remember, parents are the best well-wishers, but you have something in mind, you are also grown up, and talk to them, openly talk to them. Be very, very frank with the parents. Communication solves many issues in life, and if you can communicate well, coolly, accepting that other person can be better and right, then both we and parents and all other well-wishers will fall in line to plan our personal future. Then social. What is that social thing? Is a place very, very difficult. I want to go to XY country. I want to settle in New York or USA. I want to go to Europe or UK. It's all right. But very big conflicting decision, because it's intertwined with our past, intertwined with our present, intertwined with our environment, intertwined with all friends and family. Therefore, just like that, I want to go to New York and pass USMLE, go and settle. What will happen to me in USA? I'll be alone. I'll be leading a different type of life, which may not be really palatable to me. But I have to keep quiet because I took a jumping decision of doing that. These conflicting decisions are long-term, they require long-term planning. Most important thing is that basic plan should be very, very the basic requirement. You need to sit well, talk to your partner, talk to your parents and friends. What is your need? Why do you want to go to USA? Why do you want to go to UK? Is it permanent? Is it for a short time? If so, both of you have to go, or both of you will come back, or will go to some other country. If so, how long? When will you come back? Where will you settle? These questions have to be written on a paper. Today you write on a paper, and therefore you have 1 year to decide answer each one of them. Then it is important, as I said, building castles in the air is very easy. Our previous President Abdul Kalam said, dream big. Yes, you need to dream big. But to achieve the dream, your foundation should be solid. And to make that foundation, it is the time Start the very first day of internship. Start today. Every day matters. Missing एक दिन नहीं गया तो कुछ नहीं होता. Who am I? I have to be tail end of rounds. Nobody tells me anything. Don't tell me all these reasons. If you are active, we definitely discuss with you. Always you should be the first to come and last to go. Remember this law. If you want to really learn, come first 8 o'clock in the hospital, 4:35 at home. You should go to home. Till that time you are available. Then only you will learn. Then examine and document from very first day. Whatever you do, document in the case sheet, document in a notes for you for future. Document points you have learned everyday basis so that they help you in the NEET examination. Document your discussion about personal life and personal progression. Learn from some other discourse. Document them. Use them for planning your own life. Then proactively participate. Don't wait. Please go to the X-ray department. Write a paper and tell sister, send him to CT scan. No. Accompany the patient. Get CT done. Discuss with the radiologist. You learn points. Therefore, you think you are a doctor, the patient will be sent. And if they print report, tomorrow what happened to the patient? Sir, print report has not come. That is not the one. You don't become a doctor with that. Then always remember, pre-op preparation, proactively participate. If they want to really participate, say nil per oral, because confirm is nil oral. Nil oral means for how many hours? For solids and liquids, etc. Is the area of preparedness for what? Is it depilation or shaving? See that it is done. Then procedure. All most important, all procedure, proactively participate. Don't ask, sir, may I scrub? Scrub. If you are participating, say, for example, in medicine, do LP, do liver biopsy under guidance, and do paracentesis, do intracostal drainage under guidance. Then only you will become slowly a guide. Now you learn under guidance, then you can become a guide or a teacher later. Participate in all discussions. Don't leave any word. If there is a seminar, sir, give me also seminar. I will also do as an internist seminar in all subspecialties and specialties. I will also present a case along with PG. I will also write notes. Sir, I will also draw diagrams of operation theatre, operation. Therefore, participation proactively yourself, offering yourself in all events is extremely important. Lastly, if this is a period that cannot be wasted, and this is the biggest inexcusable error one intern can do. For decades, I am seeing 99% of interns waste their time, waste the internship. They don't learn anything. They don't do anything. And at the end of the day, when they become PG, they don't know anything. And they pass 3 years without knowing too many things. And that is not a way to learn, become a doctor. Therefore, better realize now than repent later. Do not waste your time. Realize now. Plan your professional, personal, and social aspect. And remember, it is the day, today is the day, not tomorrow. Most important thing is attire. Attire is our dress. Our dress speaks volumes. Well dressed, well good attire gives you respect. And most important part of a doctor's attire is an apron. I don't see interns coming with apron. Why? Therefore, then this inculcates discipline in you. Once I wear an apron, it prevents me not to use unparliamentary language with anybody because I am a doctor. Then remember, never come without an apron. No place for fancy dress as any doctor. Don't imitate us seniors. We are not doing apron wearing. Don't imitate us. Never come late. You should always, I repeat again, first to come, last to go. And remember, never misuse or break procedural rules and laws. If you have to absent yourself, do not absent without leave. And if you are sick, inform that you are sick. And if you are going for some reason, follow the rules of internship. There are set rules of institute, set rules of hospital, set rules by NMC, National Medical Council. All the rules need to be followed. And never be absent. Never be absent without prior information, intimation, and permission. Therefore, remember, internship never returns. You can get anything, but not internship back. Remember this. Therefore, do not waste your internship. This is the basic foundation first step of success, first step of surgical career, first step of doctor's career, medical career, first step of research, first step of skill learning, first step of communication skill learning, and therefore never misuse. Thank you very much for your patient hearing.